Debate continues over who should be in the next phase of the vaccine rollout. An advisory panel has not finalized recommendations. Now some members are saying they need to rethink the whole plan. Channel 3 Eyewitness News reporter Mike Savino is live right now with more details on this for us tonight. Mike?
Yes, Mark, some of those members on that allocation subgroup say that the goal should be to get the vaccine to both the elderly and the frontline workers who are most likely to spread this virus. But others say that that narrow focus leaves out people of color who've seen a greater impact from COVID-19.
Everyone doesn't have this luxury to isolate themselves away from the danger of COVID-19.
Governor Ned Lamont is still waiting on final recommendations from his vaccine advisory panel after its allocation subgroups failed to reach an agreement Tuesday. Now, some members of the panel say it's time to rethink the focus of the rollout.
There are certain chronic conditions that give COVID the playing ground for bad outcomes.
The panel did agree to keep CDC guidelines for Phase 1B, including people 75 and older, first responders and teachers, as well as transportation and delivery drivers, manufacturing and food workers, and DOC staff. The panel also added people in congregate settings, including prison inmates and people in inpatient care.
At the end of the day, we're all human beings. One nation under God.
Some wanted to stop there, saying the goal should be to vaccinate the elderly, who are more likely to die from COVID, and frontline workers who are more likely to spread it.
The more we dilute out 1B, the more likely it is that people will have more significant delays in actually getting the vaccines.
Based on CDC guidelines, DPH estimates it would take 9 to 10 weeks to vaccinate people in Phase 1B, 1 more week for congregate settings. Phase 1C, currently other essential workers and people with comorbidities, would take another 13 to 14 weeks. But Takesha Edwards says her board members are overlooking people of color who have experienced higher rates of the coronavirus cases and deaths. She says lowering the age and including people with underlying health risks could help reverse that trend.
I don't think if we say adding the complications of comorbidities excludes the fact of where people work.
Now, acting DPH Commissioner Deidre Gifford said just this afternoon that subgroup will finalize its recommendations next week. The group hasn't yet announced when its next meeting will be, but the full advisory group meets on January 14th. Live from the studio, Mike Savino, Channel 3 Eyewitness News.